Well, Randy Vawdrey from Physicians Immediate Care is joining us now for today's health, and it's spring, and with it comes allergy season. He's here with a little advice on how to find some relief. Well, thank you very much for stopping by this morning. First off, what are allergies? What's going on in your body when you start that sniffling, the itchy eyes, all that?
So your immune system is responding to an irritant somewhere in your environment, right? This time of year, it's often the pollens that are in the grasses and the grains and all of those environmental things that are starting to bloom. But it can happen with animal danders and dust and mites, just any irritant that's in the air.
Something that makes your immune system a little angry, I guess. Is there, I guess, starting with like natural remedies, is there a way to kind of naturally fight off allergies?
So perhaps the best thing you could do naturally is just a nasal wash or a saline wash.
So is that like the neti pot?
Mm-hmm.
Okay.
And it's not designed to necessarily treat the allergy. It's designed to clear the allergy from the nasal passage. So you just kind of rinse it out. But if you have bad allergies, oftentimes that's not going to be enough. And in the healthcare community, we think that allergies are much more prevalent perhaps than our patients think. They come in and they say, I think I have a sinus infection, but there's no fever. They're dressed and ready to go to work. They feel okay. There's just a headache and a ton of congestion. And I think there's probably a greater contribution of allergies than maybe some of the patients might think. So my goal is to help teach them about ways to address the allergies. And there's really a combination of medicines that would help. The first pearl of wisdom for patients to remember is that if they're having an allergic response, it's going to take some time to calm it down. You can't take a medicine for 2 days and say, this medicine doesn't work.
So not immediate relief.
Once you've already started responding to allergies, you've turned that immune system on, it's going to take some time to turn it off. And some of the studies will show that with antihistamines and with nasal steroids that you sniff in your nose, it can take days, sometimes to weeks, to calm them down. So the general rule is patients just have to be persistent in their treatment.
You mentioned, waiting it out. Can you do that? Do you have to go to like a pill or an antihistamine, or should you, wait it out and just kind of hang out with that?
Well, most people with terrible allergies don't want to wait it out. They're miserable. Their eyes itch, they water, they're sniffling, they're sneezing, their ears itch. Sometimes they get a sore throat and their throat itches. So I would always recommend that people start allergy medicines, and if you're an allergy sufferer, the key is start early and then be persistent through time. So if you don't have allergies now, but typically you get them, start taking some medicine.
So start ahead of allergy season.
Absolutely, and then take them every day. Don't stop.
Okay. If you say you get off track, you stop, can you just pick back up where you left off?
Of course. Yeah, so you can always pick back up, then you just have to be a little bit more persistent to stay with it. Most of the medical research will show that combination therapy oftentimes is more successful than just single therapy.
Okay.
So historically, if you've just taken an antihistamine, you might add a nasal steroid to it or a nasal antihistamine and combine those two. It's safe and it's generally very effective.
All right. Well, thank you very much for stopping by this morning.